Health Week here on News Talk 1480 WHBC. Today, we are broadcasting live from the Canton location of OMNI Orthopaedics right here on Belpar Street. Very easy to find. And OMNI Orthopaedics, boy, sometimes I feel like this could be my second home, depending on what day of the week it is. Between my family members, all of us have been here so many times. And OMNI Orthopaedics, in case you were not aware, basically treats a full range of orthopedic issues, second to none when it comes to serving their customers. And as I said, I've been here numerous times. My mom's been here numerous times, friends, co-workers, and a lot of things that they do for the community. And they started out as a really large presence here in our area, and they just keep growing and getting better and adding more things. And so we're going to talk about all of that today, as I said, continuing our discussion on Health Week here on WHBC. So we're going to get right to it. And today, first up, we're going to welcome in Lisa Hazen. Lisa's a nurse with OMNI Total Joint Replacement Center and Patient Education. Good morning, Lisa.
Good morning, Pam.
So first of all, tell me a little bit about yourself and how long you've been here at OMNI.
Sure. I'm a local gal. I was an RN that graduated from Altman School of Nursing from their diploma program once upon a time. I went back to complete my RN to BSN at Ohio University.
Oh, I'm a Bobcat,
there
too.
You go. Go
Yay.
Bobcats.
See?
So, and OMNI, let's see, I previously also did ortho case management for total joints and orthopedic spine patients. So OMNI adopted me a little over 3 years ago to come into the role of being a nurse educator because our patients have such a limited amount of time at Oasis in our surgery center or even in a hospital. It's less than a 24-hour stay as an observation or extended recovery. So it's so critical to help that patient understand the process, help them understand their role not only in getting ready for surgery, but also their role in recovery. So that's a big part of what I do here is meet with them in a small classroom setting or sometimes one-on-one. And my focus is in the lower extremities. So we're talking total hip, knee, or ankle patients.
So I would imagine that somebody's diagnosed, they have to have surgery, like you said, have a hip replacement, knee replacement, something like that, and they're scared to death. They have no idea what to expect. Right. And so in comes you.
Yes.
And take me through that process. What happens then?
Sure. So as the patient is scheduled for surgery, part of what they're scheduled is something called prehab class, which is my class. We meet small, usually about 5 patients, and their person that's their helper, their recovery person, their care coach, we call it. It's who's going to help them through initially after surgery. So we meet in a classroom setting where they are given a booklet about their joint replacement surgery. And also we do a PowerPoint. Because a lot of times if you can give a patient a reason why they're doing something, it makes more sense. So we present that rationale to them. And then they're given my business card because if they have any questions or concerns prior to surgery, they can reach out to me. They're given my extension. So
what would you say it ends up being one of their big concerns? What do people ask you the most?
Sometimes, just the word total joint replacement. They don't understand what that even means, and so we break it down. We use a model and show them what the physician's going to actually do.
And what does it mean?
It's actually, in many cases, a resurfacing of the bone where we're removing the arthritic portion of that bone and resurfacing with a metal alloy, a polyethylene, which is a high-tech plastic polymer. And in some cases, for some of our total hips, we're actually using a Biolox or a ceramic type head. So, breaking down, letting them see what the anatomy actually looks like, what the prosthesis, which are the components, look like in the body, and, their role in recovery. So we partner that with a prehab therapy class so they can get some muscle groups optimized before they head into the OR. So, yeah.
What is usually the recovery time for someone that gets a total hip replacement or total joint replacement?
Wow. It's very individualized, and I say that because we're seeing younger and younger patients have joint replacements.
I was going to ask you that
we
too.
Do.
It's
we
not
do.
just older people we're talking about, right?
No. I think I had a 52-year-old in class. So we're seeing younger patients. They're coming at it with a different health history. Sometimes our patients can be fairly debilitated. So, of course, their recovery we can expect to be a little bit longer. So, but yeah, it can take several months actually to feel much, much better. Yeah.
And how has it changed over the years?
Oh my goodness!
Because I know the actual apparatus, so to speak, is a lot different, right?
Right. A lot of how we treat the patients preoperatively, how we pre-test them, the surgical technique, the components that we use, all of that has changed so dramatically in the 39 years I've been doing this. This is year 39, which is crazy. Over those 4 decades, it's been dramatic. We used to keep the patients in the hospital and do their pre-testing and their medical clearance as a part of that maybe 10 days that they were in the hospital with us. And it's an overnight stay if they go to the hospital. So
wow,
that's
pretty amazing,
dramatic. And if we're at Oasis, maybe we'll have them 8 hours. So it's
talk about Oasis, because I mean that's a fantastic new building that we all pass on Portage, right off of Portage, and we see the building, and a lot goes on there.
Yes, state-of-the-art facility with state-of-the-art employees and surgeons that work there. We offer even the Mako robot, which second ambulatory surgery center in the state of Ohio to offer that technology for our knee and posterior hip replacement patients. So, those patients are there just hours.
Is it, I mean, you were talking about all the years, the 39 years for you. I mean, are there things that patients can and cannot do? Has that changed? I mean, I remember my mom saying, I can't kneel down, I can't do certain things after her knee replacement surgery. Right. Has any of that changed at all? Has technology made things different?
Technology, especially if we're using the Stryker Mako, that is where we're going to go ahead and get a CAT scan of that patient so we can really see that arthritic anatomy, build a 3D virtual model. It really helps with the prosthetic fit post-operatively. It's just a great tool for our surgeons to use for that customized fit. So in some instances, though, I don't believe our patients with a total knee can still kneel. That, again, it's a very personal, if they feel comfortable kneeling afterwards or not. But
so I guess you would say for OMNI, they have every step of the way covered with all of this, right?
Yes.
And
we
you're
like
part
that.
of that.
Yes. Yeah, we want them to have an excellent outcome, and it begins from the moment they step in the door and are told they need to have that joint replacement. So,
and I'm told that after you leave here, you will go and teach a class. Is that right?
I am. I will be in the classroom at 10:30. So, yes, absolutely.
And these are all people who are going to have some kind of joint replacement.
Yes. Today will be all total knee patients. So,
total knee patients. Yes. Wow. And I mean, how do you take the fear away from a patient? I mean, I know you can't take it away completely, but
I think education is huge. I think having a face that you can recognize when you call over the phone, you know who you're talking to, and you know it's a veteran RN who has orthopedic knowledge. I think all of that helps decrease that anxiety level. So,
when people, it's very true. If you are there and something's happening to you and you have no clue what's next or what's going to happen, that makes
the unknown.
The unknown,
Absolutely.
yes, the fear of the unknown. That's exactly right. Well, Lisa Hazen, we appreciate you coming by and talking with us this morning. That a lot of great information there, and I know folks who are maybe even thinking about having to get this done, maybe they'll say, okay, I think I can do this as long as I can ask questions, right?
Absolutely. That's part of it.
All right.
You're very welcome.
We appreciate it. And when we come back, we'll take a little break here. Again, we are at OMNI Orthopaedics on Belpar. And when we come back, we're going to talk sports medicine, athletes, and maybe how they injure themselves and how OMNI can help them. We'll do that here as Health Week continues on News Talk 1480 WHBC.